Since the mid-1950s, we've had a cure. We've simply let 150 million people die anyway. Everything is Tuberculosis by John Green. Audiobook summary and review by StoryShots. A disease we learned to cure 70 years ago still kills more people than any other infection on Earth. That is the paradox at the center of Everything is Tuberculosis, the history and persistence of our deadliest infection, by John Green. He wrote it after meeting a teenage boy in Sierra Leone whose body had been stunted by a bacterium modern medicine had already defeated everywhere else. The disease that isn't really biological anymore. Most people assume tuberculosis is a relic, something from Victorian novels and old sanatoriums. It is not. TB still kills over 1 million people a year, more than malaria, typhoid, and war combined. The bacterium that causes it has barely changed since Robert Koch identified it in 1882. What changed is who gets access to the cure. In wealthy countries, TB rates fell before antibiotics even existed, driven by better housing and food. In South Africa today, the infection rate runs 250 times higher than in the United States. Same microbe, wildly different odds of survival depending on your zip code. Tuberculosis doesn't choose its victims. Poverty hands them over. You already live inside a health system that decided, long before you were born, whose lives were worth protecting first. This is not a story about a stubborn germ. It's a story about a stubborn system, and that system runs on a specific kind of math. The vicious cycle nobody wants to name. Picture a 17-year-old boy in a Sierra Leone hospital who looks 9 years old because malnutrition and disease have stunted his growth. That is Henry Ryder, the patient at the emotional center of the book. His treatment gets interrupted when his family turns to faith healing, and the interruption breeds drug resistance, which demands medications costing thousands of dollars. Here is the mechanism worth sitting with. TB is a disease of vicious cycles. It's poverty that worsens poverty, illness that weakens the very healthcare systems meant to treat it. Standard treatment regimens were designed in the 1970s and have barely changed since, because the patients who need new drugs can't pay for them. But knowing the cycle exists doesn't tell you how anyone ever breaks it, especially when the economics are stacked against the sick from the start. Who actually decides who gets to breathe? When COVID threatened wealthy nations, the world spent $51 billion for COVID vaccines in year one. TB, killing nearly as many people annually, receives under $1 billion. Same planet, wildly different checkbook. The bacterium didn't change. Our willingness to spend money on the people it kills did. That gap between 400 billion and 4 billion is not a scientific limitation. It's an accounting decision about whose survival counts as an emergency, remade every single budget cycle, in ways most of us never see. If this changed how you think about who global health systems are actually built to serve, someone in your life probably needs to hear it too. Final summary. This summary of Everything is Tuberculosis connects 3 threads. Geography decides who survives a curable disease. Poverty traps patients in cycles that manufacture drug resistance. And global spending reveals whose lives get treated as emergencies. John Green turns this argument personal through Henry's years-long fight against multi-drug-resistant TB, and through history. The cowboy hat, the assassination that triggered World War I, his own great-uncle's death in a sanatorium. The full summary covers Green's specific policy blueprint for elimination, his activism that helped cut a drug's price, and the economics behind why $1 spent on TB returns up to 46. We're putting together the full summary of Everything is Tuberculosis right now. with an infographic and animated video. Follow the book in the StoryShots app to get it the moment it's ready.